I now invite Dr. Sayan Basu, who's going to talk to us about 3D printed cornea.
All right, thank you so much for making me a part of this session. And just like Ashish mentioned, I am also not a saint, and I have the following disclosures about the products that I'm going to talk about in my presentation. So the context basically is corneal regeneration, corneal replacement. We are basically interested in restoring vision to patients who are blinded by corneal opacification. In our country, the most common cause is post-infectious and post-traumatic scars. And the problem is that this peculiar indication for corneal transplantation unfortunately does not carry a very good prognosis. Therefore, we have to look at alternative options for addressing the problem of corneal blindness. The other problem that we have in our country, and this is prevalent and true for most of the developing world, is that we do not have enough donor corneas for transplantation even if you wanted to do. So it's a double jeopardy. You don't have enough donor corneas, and even if you have corneas, if you do transplants for patients with inflammatory conditions that lead to corneal scarring, those grafts will not work very long, and then you have to keep repeating those grafts. So what can we come up with as a solution? So this is the problem on your left side. The problem that the solution that we are aiming for is on the right side, which is a biomimetic stromal tissue alternative to replace the scarred corneal stroma with bioengineered corneas, which has the mechanical strength that is required and that the normal cornea has. It has the right curvature and shape, and it can integrate into the host. And just like we suture corneal grafts in place, it should be suturable as well. So that's basically what we are aiming for. So if you look at the cornea, it's a very simple and very elegant tissue, and therefore it is not so difficult to bioengineer it. There are basically three components: the keratocytes and the extracellular matrix, which come together to form the corneal stroma. So if you're looking at a stromal substitute, you have to find a way in which you can replicate the keratocytes, but mostly you're thinking about the extracellular matrix, which is about 90% of the stroma. So 3D bioprinting, what is this? So just, many of you may know how printing works in general, inkjet printers or extrusion printers, that you put in an ink cartridge and there is a nozzle which prints out whatever you want on a piece of paper. You can do this in 3 dimensions, and so this is widely used in industry. But if you use a biological tissue as the ink, instead of printing words on a piece of paper or instead of printing out plastic devices, it can also print out tissue. So that's the concept that we are trying to leverage here. So there have been a lot of bioinks that have been tried in the past. What we are interested in is called the decellularized corneal extracellular matrix. We call it the DECM. This is the proprietary product that we have. So essentially, in eye banks, a lot of corneas are wasted because they are not optically suitable for transplantation, essentially because they don't have enough endothelial cells, but they do have normal stroma. We can harness that. Also, when you do a keratoplasty, you throw away the corneoscleral rim, which is not of any use. Now you can also derive the stroma from this. So basically what happens is all the cornea and the corneal parts that are discarded, you can take them and decellularize them, make them into a lyophilized powder, and then use that powder to make this gel, which is called the hydrogel or the DECM gel. We have done a lot of testing with the gel and found that you can apply the gel itself for wound healing, but the gel can also act as a bioink for 3D printing. So this is basically what our workflow is. We are looking, the problem is on the left, the solution is on the right, and so we are looking at different tissue sources. We have now finalized the DECM as a tissue source. Then we are looking at how the different ways in which this can be printed and how we produce the bioink, use the bioink to 3D print corneal tissue, and then we have to do this extensive preclinical testing so that it can finally be then used in patients. So essentially 3D printing, there are 2 basic types of technology that you can use. One is the extrusion printing, which I was talking about earlier. The other is light-based bioprinting, which is more precise and you can print at a higher resolution. This is an extrusion printer in action. You can see on your left, you have the printing, and on the right is the printed sheet. So there is a small nozzle from which the bioink is coming out, the hydrogel, and it is printing in 3 dimensions. So you have this sheet of printed tissue that you see on the right side. This is flat, it doesn't have a curvature, but you can use a trephine and then cut it to size, and then you can take this circular piece of tissue and use it for transfer. You can see that it looks exactly like normal corneal stroma. So this is very simple extrusion based printing. You have a printer which prints out a sheet of tissue, and then you can cut that sheet of tissue to size. But what you would like is a little bit more to this, and that you can add a little bit of shape and curvature to it as well. And you can see on the right side that after taking that tissue that we have cut to size, we are now using it in the wet lab to see if it can be sutured as well. And you can see here that the suture is cheese wiring, and therefore this is not suitable for transplantation. So you can also do cross-linking on this, and you can also use molds then to now add curvature and shape to this. So instead of taking a flat sheet of tissue and then cutting it to size, you can actually print a curved tissue using a mold. So here the 3D printer is printing on a pre-defined mold where you have defined the curvature and the shape of the cornea. And then you get a tissue substitute that resembles the cornea more closely in terms of not only transparency, but also in terms of shape and curvature. And you can essentially customize any shape and any curvature using this strategy or this approach. So right now we are doing preclinical trials with this 3D printed customized corneal lenticule. So in the rabbits, basically what we do is we remove some stroma. You can see here that I'm dissecting out a stromal lenticule and creating a defect which is about 300-400 microns deep. And then we use the customized 3D printed lenticules, and we are putting them on the defect that we have created on the rabbit eye and putting them in place. So you can ideally this can be sutureless, and you should be able to suture them as well in case you are addressing a larger defect. Here we are just using fibrin glue to attach this tissue. So this is what basically it looks like. So it requires a little bit of engineering, which is called CAD modeling, to design basically what is the shape and size you want to give to these corneas. And you can also cross-link them to add further strength. So what we do after making these corneas is that we test them in the wet lab to see how they are behaving in terms of handling, that are you able to pick them up, are you able to move them around, and then we will also test them for their mechanical strength in terms of suturability. So here you can see a tissue on the left side which is not cross-linked, and a tissue on the right side which is cross-linked, and they behave slightly better. You can see that the tissue on the right is a slightly firmer, the tissue on the left is a little bit floppy. And then once we have customized these lenticules, then we do the suturing strength to see if they are suturable. This is a term that we have coined. There is no dictionary term which actually spells this out. And what we do is use 10-0 nylon sutures, which we routinely use for keratoplasty, and see when you are tying the knot whether the fiber of the suture cheese wires or is able to hold it. So here you can see it is able to hold the suture, but the handling is not good. When you're using the forceps, it is a little bit brittle at the edges. So this is not, we are not happy with this. So we want something better. So this is another substitute that we have printed. Here you can see that the suturing is good, the handling is also good, the edges are not brittle and the edges are not cheese wiring. So this is a much better alternative. You can also see that it is transparent. So after having gone through a lot of trial and error and having used different resins also to cross-link. So if you cross-link using different resins, and the tissue becomes a little bit, it gets this yellowish kind of tint. Of course, if you wash it, it goes away. But these are the substitutes that we are working with now. And as you can see that photograph, that they look pretty, they're very transparent and they look very similar to native corneal tissue. And this is the product that we are interested in taking to clinics now. We call this the Neo Cornea. This is developed in collaboration with IIT Hyderabad. As you can see in this video here, I am suturing with 10-0 nylon on a artificial anterior chamber, and you can see that not only is the tissue transparent, but it handles very well. I have absolutely no issues in putting the sutures. Here I've put 4 cardinal sutures, and the sutures are not cheese wiring. It has enough mechanical strength, it has the right curvature, and it has optical clarity as well. So just to conclude, I think the future is very exciting for all anterior segment corneal surgeons, because the number of cutting-edge regenerative therapies are on the horizon, including stem cells. We are all assessing their safety and efficacy right now in preclinical studies, but you will have in the future, in the very near future, cell therapy for corneal ocular surface inflammation, just like you have anti-VEGF therapy for neovascularization in retina. And you will have these hydrogels that you can put in with patients with trauma and inflammation that can cause scarless wound healing. And you will also have 3D printed substitutes. And I foresee that this 3D printing will not only be there for corneas, but you will see 3D printing come into vogue in a lot of other applications. For example, contact lenses and also intraocular lens printing. And you can actually customize and 3D print an intraocular lens based on the patient's power and the refractive error. Thank you so much.